So we're here today with the main man, Dr. Adeel Ali. So Dr. Adeel, nice to see you, bro. Good to see you, bro. Good to see you. How's it going, man? You good? So yeah, we've got Dr. Adeel here. He owns Smilewell Dental. He's also an author of the book that we see in front of us now. And you also have a Growth Academy for implant dentists who want to further their skills, right? So thanks so much for joining the podcast, bro. It's an absolute pleasure to have you on. So in today's episode, we really want to kind of dive deep into really the background of yourself, Adeel, and understand as well and help the other dental practice owners out there to understand kind of the mindset that you've had building your business. So I think the first question is, I think it'd be good to go back to your childhood, kind of where you started and what made you want to get into dentistry.
Well, I mean, firstly, Joe, Myron, thank you so much for inviting me on the podcast. It means a lot, honestly. I'm a guy from very, very humble beginnings, and to be invited on a podcast, with yourselves, it's a big honor. So thank you for that. In the short period of time, of being a dentist, well, it feels like sure, it's been 17 years now. I just sometimes you sort of got to pinch yourself, and the relationships that we built, not just with your team, with your patients. It's sometimes you got to just take a step back and just be grateful. Grateful to my family and grateful to God for the wonderful things I've been given. So so from childhood, it all started. I'm not privately educated.
Yeah.
I went to a very, very tough school. I had a tough time. I'll be very honest with you. I think when I think back, I think a lot of sort of resilience and the kind of moves I've made in business probably related a lot to my childhood. I think a lot of my friends can probably testify to that. But yes, school was great. I had great friends that support me throughout the whole way. Rough school, tough. Also, had a lot of insecurities as well. Something that I can probably talk about today. I grew up, I still do have a very big birthmark on my face, which made me very insecure about myself, especially when you don't have facial hair. It's visible, you get teased about it. So I think a lot of my confidence came with trying to sort of outperforming my insecurities. I commonly just kind of hide it in class like this, so the girls can see it. You know what I mean? But then what I would then do is just kind of overcompensate by trying to be like more extroverted than I actually am. That led me to doing a lot of school plays.
Sure.
I played the and singing on stage and doing acting.
Sing it.
Yeah, well, yeah, a little bit. No, so I played Danny Zuko in Grease. I played Jake Blue in the Blues Brothers.
So can you dance as well?
No, well, I could do the moonwalk, but I don't know about the knees and that. But yeah,
Cool.
did drama at GCSE, did the theatre studies.
That's interesting. Both of my we did that as well.
You did that as well?
That's where we actually met. Yeah.
In theatre studies?
In drama. Yeah.
Yeah, drama.
Literally. Yeah.
Do you know what? I think every kid should do drama. My son's just going to GCSEs now, and I said, look, it's going to be mandatory. It just builds up so much confidence. You know what? Just speak on stage. Exactly. And I think really, we should be pushing our children to do more that and sports.
Younger they are, like I've always said, my kids are definitely going to be on stage, 100%. 100%. I'm going to try and make sure that they have the confidence built from young, so that they can actually go forward in life from that. So, because remember when we were at school and doing drama, and you perform in front of the class, and then they went and stuck us at the curb in Leicester, and there was like 500 people there. And I've never been so scared in my life. But I think once you do something like that, the confidence it actually builds is phenomenal. So yeah, you did.
And it helps in you must have helped you in your business as well.
Yeah,
right?
Of course. Yeah. And even for example, like doing events and things like that, going up on stage and speaking, I guess that's probably stems from the confidence built up doing that, right?
Yeah. Absolutely.
But a question I have is so in school days as well, because did you find that you had like an entrepreneurial mindset from early?
Yeah, I did actually. I think I do think back a lot, and why am I the way I am? I think I did have an entrepreneurial spirit because I think it came from circumstances. To be very honest, I think the conversations that used to happen, and when you're a kid, you listen to your parents, having good times. Sometimes they argue, and the arguments are always about financial problems. Always. I remember my dad fighting with the water company, with the electric company. I remember the guy coming in, I was a kid, he came in and he just switched the electricity off, and then so I remember these things are very, very vivid. So in my mind, and I think that just led me to say, you know what, I just don't want that situation. I don't want my parents to be always on edge. I don't want to be worried about money. You know, so my dad used to work, he did retail. He's done retail for 40 years. That's another experience that kids need to go through. Retail. Have retail, a retail flip. That thing builds you with strength. If you can get through retail, you get through anything in life, right? So, so my dad used to work in a company called Booker Cash and Carry. He was an area manager for several sites, and they used to get, you know, like these broken, you know, you get the, you know, sticker bars, and you get all these chocolates that come in boxes, right? And if they get damaged boxes, you can't sell it on. So he used to bring that back home. He used a big bag of chocolates, you know, for 10p, and then I used to take that to school, and then sell it on, you know. And so you know, I used to sell it to my mates, and
From hiding from the teacher in the playground and selling.
I remember, you know, it got to a point where people got to know who I was, and then they all jumped at me one day and they rushed me. They took my chocolate. Then I tried to complain to the teacher, and the teacher was like, "Well, you know, you shouldn't be doing it in the first place." Dealer. So that was it. Yeah. Then so I got to 16.
Yeah.
My first official job was in a ladies' shoe shop.
Okay.
In Wood Green, North London, selling ladies' shoes, and that was a great experience. So it was the first shop that there was a sales floor, and upstairs where they used to stock all the shoes, and there was a dumbwaiter. So we used to send the shoes from the top down the dumbwaiter, and we used to sell it on the shop floor, and we used to have walkie-talkies. So some days I was on the shop floor, some days I was upstairs, and you know, the amount of codes, you know, when I used to be upstairs, the codes, you know, AM, I still remember the codes, AM093, AM093, yeah. So that was some most popular shoe brand, yeah, AM093. I don't know, you guys are probably too young. It was called Wallabies, these Wallaby shoes. You know, Wallabies, yeah. So I remember, like, you know, it got to a point that, you know, I'd go to bed and start dreaming about codes. So my colleagues at work, you know, they said, "Have you started having dreams about codes yet?" I was like, "Yeah." That's it. Then I did that, and then just before uni, I got a job at a Booker Cash and Carry. So my dad got me a job in one of the other branches, and that's the first experience I had with a robbery, big robbery. So it was funny because I was one day I was there, and you know, there's a little pamphlet just on a desk. So I picked up the pamphlet. I started just randomly. It says how to deal if somebody comes into the unit when there's a robbery. So it said to, you know, don't make any sudden movements, look at the floor, stay still. It's like, okay, cool. Literally the next day, I swear to God, literally the next day, I'm standing because I was doing security. I had to check the amount of items against the invoice, make sure nobody's stealing anything, right? I just hear a massive scream. I said, what the? I said, see, this guy, I swear to God, I thought he had a whip in his hand. It was a machete this big. Oh. I was like, and he grabbed he grabbed her hand. He was walking with her, yeah, right beside me, yeah. So I just remembered why. So I was hostage. He was just pacing. You know where Yash is? This is the distance, right? So he's just pacing up and down. And I remembered reading that book. So I looked at the ground. I was totally still, but my right leg was like this. He says, "Don't you fucking move." I was like, "Man, I ain't moving anywhere."
Don't worry about.
Yeah. So yeah.
How old are you then?
I was 17. 17, yeah. These are big men, yeah. And I could see all the other stuff they were hiding. They just bolted off, left me. And you don't effing move. Like, bro, I ain't got no intention of moving, yeah. Then, you know, they stole a whole load of money. They left, and then the manager came to me and said, "Why didn't you jump them?" I was like, "Are you mad? For whatever, for what is it, £6.20 an hour? Not worth it." And then after that, so I did that. Then I went into university.
Yeah. So where in the whole childhood then did dentistry come from? Like where did that spark for you? Was it?
I was always interested in science. You know, I love science. You know, and I think I attribute a lot to the teachers that you have. You know, if they build a lot of passion into you, you kind of want to do that, right? So I was always interested in science. You know, in year 7, I remember just sitting and learning the periodic table. I just loved it. It's like, I had a fascination with, God's creation, and I've always kind of been inclined towards that. So for me, it was either medicine or dentistry. I talk about it in the book as well. And then my best mate's brother at the time was a doctor, and he said, "Just don't do medicine, mate. Just
put you off.
yeah, put me off." He said, "Just do dentistry." So I said, "Look, yeah." And to be honest, it's a lot of blind faith as well. I mean, at the age of 17, do you really know yourself? Do you really know, what your passions are? Yeah, I mean, you're still a kid, right? So you just got to kind of roll with it and say, "Look, this seems like a good profession." There's a mixture of science, and I'm not really artistic, but there's a mixture of that.
Yeah.
And you can, there's business opportunities at the end of this. So let's go with that.
Was it a case like when you went and decided you were going to do dentistry as a course, right?
Yeah.
Did you find that the passion just exploded right away?
No.
Or was it a gradual?
No. I was shit at dentistry. Yeah. I mean, I just, my hands couldn't move. I had my, good friend who I did my first Scott practice with, Camille. I mean, his hands are just like, he could just, another colleague is so good, but it's just, how do they do it?
Yeah.
So I probably until like, I wanted to drop out up till the first 3 years, and then the 4th year, I had a very good clinical demonstrator. Just sat, we talked about it in the book, and, he just believed in me. He didn't say anything profound.
Yeah.
But he just sat down with me and said that you've got skills, you've got this, and he just, I don't know, I think, when you've got a sort of mentor like that can just look at you as an individual, and you're like putty in their hands, right? If they believe in you and they say the right thing, it just can spur you in a whole different direction. So I was very grateful to Dr. Heaton for telling me that. So from 4th year, I started to enjoy it a bit. And then the real growth started after qualification.
Yeah.
Yeah.
When you actually got out into the world.
Got out into the real world, then I met my first mentor, Dr. Balwant Bakaria. Yeah. And then that's where my love for dentistry and implantology really kicked off, yeah.
So what was some of because you obviously mentioned maybe some insecurities as a kid.
Yeah.
What was some of the limiting beliefs that you had to get over to kind of get to where you're at now? Like, what were some of the biggest things that you had to get over mentally to, become?
I think one of the biggest things is that, I'm not from a business family.
Yeah.
I don't have any family in business, so nobody ever had any business knowledge, So I didn't think I could be a businessman. I thought I had to be sort of a dentist and work for a living, right? In that regard. So that was probably one of the limiting factors. I think with my dad's job, because it's retail, is really hard. Yeah. I never saw Dad being very, very passionate about what he did. So I just assumed that you just worked for the sake of working. You could never really enjoy your job. You just had to grind and earn for your family, and somewhere down the line, you could potentially retire. Okay. In terms of having sort of a mentor like Balwant Bakaria, it was kind of like, Kiyosaki's book on Rich Dad, Poor Dad. I got my poor dad, in it, who I love very, very much, and I attribute so much to him and my parents, but then I had a rich dad that totally flipped the script on me. I saw him, he actually loved his job. I mean, he turned around one day and said, "Adeel, I've never worked a day in my life." I was like, "Well, what do you mean?" He said, "Because when you love what you do, you don't feel like it's like work." I said, "What the hell is this? I've never come across a concept like this before." Honestly, I was bamboozled. This is probably, 1-2 years into dentistry. I was like, so people actually are passionate about what they do. So that concept, just getting over that concept took some time, but I was so glad, that certain people came into my life at the right time. Yeah.
Sure. I think it just goes to show how important having the right mentors are along your journey, right?
100%. Because you know what? most businesses have already been done. In terms, and there's pathways for success. You don't really need to reinvent the wheel unless you're an Elon Musk or something. When it comes to dentistry, there's been a lot of successful dentists, and I think you need to find a mentor that you can assimilate with, that has a very, very genuine care, not just for you in the clinical domain, but you as a whole, as an individual. If there's synergy there, it's worth just going on that ride. Sure, that mentor.
And how did you find the right mentor, do you think? Like, was it a case
that just a chance thing?
That was a chance thing. I mean, the guy put up a job ad on BDJ jobs. I then called him up, left a voice note, put the phone down, and he phoned me straight back. He said, "You're the only guy that left me a voice message. Why should I hire you?" I said, "Well, I ain't got any, I don't have the experience, but I'll flip and outwork anyone." And I think that's one of the things I think that defines me. I thrive of working hard, and I just put, even with the young guys, I'll outwork anyone. That's my motto. Before skill or anything like that, hard work.
100%. 100%. So what do you think the real difference is between being, say, a dentist that owns a practice or just works clinically, right, compared to being an actual entrepreneurial dentist? What do you think the mindset shifts really are from a lot of people that are doing it? Maybe they're running their practice thinking that they're actually building like a business, but they might not realize that, they're just working in the business and they don't have the time to actually.
Well, this entrepreneurship has, caught a lot of wind, like the cool thing, right? I want to be an entrepreneur. I'll be very honest with you. There's nothing like really sexy about entrepreneurism in that sense. I had no choice but to be entrepreneurial. It came from a place of desperation. You either sink or swim, right? Sure. So I was put into that position to say, right, I'm in this position of, I got married young, didn't have any money, had kids when I was young, had to, support mum, dad, extended family members. Now I've got a wife, got kids. I need to do something different because this paycheck thing's not cutting it. So I needed to become an entrepreneur. So what did I do? I was working in Southend-on-Sea for 10 years. I used to commute from North London to Southend-on-Sea. After that, I'd go to my practice in near Canary Wharf and then drive back. All on the way, listen to YouTube videos on entrepreneurs. And, Grant Cardone is a big influence on my life. I've been listening to him for the past 12, 13 years. And just listening to, we didn't have podcasts. It's just any YouTube video I would get. I had this whole car sales. All these, 12 CD, I'd play that thing on repeat. I did Ashley Latter's course many years ago. I had his CD. I just played the same thing over and over again because I couldn't rely on a fixed income, Dad was helping out with the family. His income was fixed. Now the kids are coming. The expenses are increasing. We need to move house. I had to become an entrepreneur.
Yeah. That's really interesting that you said like the Grant Cardone, the other sales side of things.
Yes.
How influential do you think learning sales has been? Because I think sales is a big taboo word in dentistry.
I mean, I have no issues with using the word sales. I have no issue with it. One of, a good friend of mine, we were talking some time ago and he said, you know what, Adeel, sales solves everything. And that's the part of the blood of an entrepreneur. When the chips are down, if you're good at sales, it can get you out of a lot of problem to bring that revenue in, especially when you're growing a business, right? So, I think if you're insecure, you can't use the word sales, but essentially what we're doing in dentistry is selling. But sales doesn't mean that you're providing an option for a patient that's not good for them or it's not beneficial for them. It's beneficial for them. It's more beneficial for them than the one that's providing that service.
I think that's the reason people don't like the word sales because
well, you can call it what you want, but it's a sales, right?
Yeah, they associate it with negative connotations. But I believe if you know the person in front of you needs what you've got,
exactly,
and it's going to improve their life, I think it's your duty
100%
to get them to.
Well, if you look at the definition of sales, it's to persuade the merits of, right? Now, if you're not a good communicator, how are you going to persuade the patient the merits of? I mean, we've been in situations where I've spoken to patients and I know I've had an off day, my communication hasn't been good and so forth. And you just feel gutted that the patient just didn't make the right, it's the right option for the patient. But because of my communication or, or the patient flow or the practice or the deck, whatever it is, patients aren't making the right best. What's best for the long term? Do you see what I mean? So, which probably leads us into the next question about, what should the workflow be within the business?
Yeah, sure.
Yeah.
So yeah, let's touch on that. Let's touch on the workflow that, like we've been to the practice many a times now. We obviously work with you on the marketing side, and yeah, every time we've come, we've seen the patients, like they come here and I feel like it doesn't feel like they're coming to a dentist.
Yeah.
Especially like when they see you, it's like they're seeing one of their family members.
100%.
how do you build this sort of rapport, and what's your sort of workflow like?
Well, the first thing, Joe, you can't fake it.
Yeah.
This is authenticity is everything. And I say to my mentees, if you're not authentic, just don't be in the job, or just this is not the right thing for you. If you don't have a personality, you try and develop one. You need to be, especially if you're opening up a swap practice, with no reputation, no brand, nothing. The only thing that you've got is you as the leader of the ship. Yeah. And whenever patients come in, you need to treat them like gold, right? They need to sort of magnetize themselves towards you. So patients come in, you just need to know that they got you covered.
Yeah.
Yeah. So patients come in, we treat them like family. And a big part of dentistry is that what I also said to my mentees, yes, it is healthcare, but it's the entertainment business as well.
Yeah, sure.
Make people feel valued, make people enjoy the experience, because the whole world out there, majority of people have got a very tough life. We're fortunate enough to be dentists, and I don't have to worry about my mortgage. I don't have to worry about if buying the shopping for the kids. Thank God. Do you know what I mean? I can put clothes on their back. But for the majority of people in the country, they are struggling. Yeah. Can you, when the patient comes in, can you just transport that patient just for an hour of their day in a totally different reality? And that's what we're trying to do with something like a smile, a handshake, embracing them, just to make them feel good and valued before they just go back into normality. And that's what we try and do here.
So the dentist that's watching this and thinking, okay, Adeel, like, I would love to do that, but how? How can I actually get...
What I'm telling you doesn't take finances.
Yeah.
I've been like this my whole life.
Yeah.
I've been like this in really rundown practices. Yeah. So there's no excuse. You can always do something to make somebody feel $1 million.
Yeah.
You can. Yeah. I've worked in NHS. You've seen some of the practices I work like, I used to work in a practice that didn't have any heating in an outhouse. There's no, when I used to talk to the patient, you can see the air, the steam coming out. Yeah. So I used to wear 2 layers of socks. It was so cold in that place. Yeah. And when it was drilling, my hand would be shaking so cold. I swear to you. So, this excuse that, I don't have the finances, it's bullshit. Right?
Yeah. Sure.
You need to put 100% effort every day. I've been doing it for 17 years, Joe.
Yeah.
Every day, every patient. I was saying to these guys, I had a patient, I just flew back from Qatar. The first patient I had, small value treatment, right? They paid, they wanted a £1,000 treatment plan. Yeah. Give it everything.
Yeah.
The next patient wants a full arch, upper and lower, yet different value treatments. Everybody gets the same. Whether they need an emergency thing, it doesn't matter. The effort has to be every single patient.
Yeah.
Every single time.
I think it's one thing, the owner and the principal having that mindset, but it's also another thing having the team have that mindset, right? And that's very clear here that everybody is very aligned on that.
It has to come from the leader, right?
Sure.
So what systems would you, so when it comes to like your patient workflow, right, in the practice, what systems would you say that you've had to implement over the years with yourself, the team, the practice as a whole? What kind of systems have you done to actually make patients feel that, that sense of, they're the most important person in the room, and making it that bit smoother in terms of everything?
So obviously you've got sort of, after when you're practicing for someone, you've got sort of intuition as to what kind of works.
Yeah.
When it comes to consultation, just in that room, I've developed a sort of sales system. How I do my consultations is an 8-point system. That's going to be the next book, by the way, the Komodo approach to sales and dentistry. So wait for that one. So it kind of centered around that. So I put like an 8-point system in, and then bringing on, what helped me was bringing on people and partners from different industries.
Yes.
Right. So my business partner, Adnan, he's not from dentistry. He's worked in different industries, and just saying how they do sort of sales in those industries comparing to what we do in dentistry.
Sure, actually me.
Oh, ads. Yeah.
He's a behind the scenes kind
He's behind the scenes. We had a mutual friend. So I was starting the business, and I'm a guy that wears my heart on my sleeves. Yeah. But my wife is a lot more. She has to rein me in. Yeah. She's a look, Every bad decision I've made, I've gone against her, by the way. Yeah. So we were opening up the practice. I said, look, I am not going to open up a practice and try and run this practice, because I need to do what I need to, and we need to bring the right people in. Because remember, I was traveling around and doing implants. Now, all of a sudden, if I open my practice, I'm doing something where my skill set isn't sort of strong there. I'm not going to do it, right? So I said, we really need somebody in ops to do the operational management of this thing. My wife's good at finances. Obviously, I'm a clinician. So we got introduced through a mutual friend. So we met ads, and I was like, yeah, let's bring this guy on. yeah. But I said, hold up, let's do it. So when my wife said, you know what, I think we should bring him, then I was like, yeah, this is, and for by the grace of God, it's worked out really well. So it's the three of us, and we built up this beautiful practice. And
I think it's a great mix. Like, he's a super switched on guy.
I tell you what, just like you guys, I think the key thing in any business relationship is loyalty.
Yeah.
I mean, these are cardinal values that can't be developed overnight. This is, you either have that from childhood or you don't. I know I've always been loyal to people. Adnan's always been loyal, and my wife is loyal. Does that make sense? And again, it comes back to my childhood. Like, I would, if anyone, my mates are having a problem or anything, I'd be stepping in. I've just always been like that. Any of my clinicians have a problem, I'll say, you know what? I'll deal with the complaint. Don't worry about it. I got you. If they got an emergency, I'm there. I'll step in, and that's when the owner, when the principal has this sort of these values, the staff see it, the dentists see it, and then because you can't sell a proposition if you're not living it yourself.
Yeah, you got to lead for sure.
You got to lead by example. You have to.
You can't expect someone in your business to do something that you wouldn't do. And I think that's what's super important. So if for the dentists that are there and they think, okay, the dental practice owners say, and they're thinking, okay, my team, the workflow of my patients I know it's not good enough. Where would you start for them? Like, where can they start to kind of identify the areas and maybe some things that they can start to add in that could have a big difference?
Well, it comes back to the leader going, if I was going into a practice, and I've sat down with a lot of practice owners, friends, not friends, so put that aside. Let's talk about who's leading the ship. Do we have any flaws in the individual that's leading? That's the first thing to focus on first. Now, is that individual moldable or not? Me and Ads, we were talking to a friend of ours that were helping their business at the moment, a very good friend of ours, and we've said, you know what, you need to be out of the business. Your PM is actually, you don't know how good your PM is. Let her lead.
Yeah.
Do you see what I mean? So, and another good thing about partnerships and you can't be a yes man.
Yeah.
I think the good thing in our three-way business relationship, there's, we will sort of shoot each other down if it comes to it, and practice owners also need to be like, they need to be open to really strong feedback, even if it goes against them, Same with mentees, if they need to be pulled up, I pull them up, but they know it's coming from a good place. Unfortunately, most dentists, and the truth of it is, they've been put on a pedestal their whole life.
Yeah.
Most of us have been to private school, then we've gone straight into university, and then straight into dentistry jobs. Dentistry is sometimes their first job. So it's always been, yes, you're great. When they get a bit of friction, how do you react to that? Do you see what I mean? So that's really important. So what I'd say to any dentist that is that sees holes in their game, in their recruitment, in their patient workflow, wherever it is, put that aside. You just got to be damn honest with yourself. Yeah. And if I talk about it in the book. Sometimes I find it difficult critiquing myself. So I'll turn to my wife and say, look, where am I running short?
Yeah.
Am I losing the plot here? Am I on the right track?
Yeah.
What's going on? And to have that sort of relationship with either a business partner or a spouse, whoever it may be, is gold. So I'd focus on the individual first. Then if you get the individual right, honestly, like I said, you lead by example, so you'll be able to develop a culture around it. And to be honest with patient workflows, it's like a cookie cutter exercise. You could take what we do here and put it into another practice, no problem. But it has to stem from the leader.
Yeah. So one question I have, right? Because a lot of practice owners come to us and they say, look, I've recently hired a lot of new team members. Might have even opened up a squat practice, right? And they'll say, look, we're finding there's teething problems with the team. They're not following the SOPs right away. Yeah. So how in this practice, of course, I know yourself and Adnan, you've had a big key role in this.
Yeah.
Like, how have you managed to make sure that all of the team members, from the nurses, even to like the lab technicians, everybody in this entire sort of place is always moving in the right direction and following the SOPs and hitting their KPIs?
Well, the truth of it, they don't always stick to the script. It is what it is, right? It's constant fine tuning. Why aren't they sticking to the script? Now, if you open up a squat practice, there's going to be change in the team.
Yeah, of course.
Yeah, some people aren't clocking onto the culture. They don't necessarily resonate with our values. Some people, unfortunately, you know, we've invested a lot of finances and time into this. If the skill level is not what we thought, listen, you don't feel guilty about having to change your team. You know, we're still tweaking.
Yeah, of course. Yeah.
We're still tweaking. There's no.
It's never ending.
It's never ending.
And even someone that comes in, like we've noticed, like building our team over these last couple of years is like, even someone that you really thought was going to be great, like, or they might even start out really great and then something might happen. Like, you have to be willing, and I think that's been one of the hardest things for us.
Yeah, exactly.
Is when, like, we know that there's someone in the business that, okay, maybe it's time to move on.
Yeah.
I think it's being able to have those conversations, because I think a lot of people avoid them and they'll keep someone in the role for far too long. And I think that's one of the biggest things we've had to learn is that, okay, when it's not right, you've got to be able to step up and have those conversations.
Because you've put everything on the line for this business, and you've created the, you know, for the business owner, that we put it all on the line.
Yeah.
We put it on the line every day. And if it's not resonating with the team member, then we have to unfortunately have hard conversations. But if, you know, any dentist that's, you know, starting a squat private practice, just accept that it's going to be a bit of a roller coaster, and that's just part of it. You know, self-doubt, not having the right team, like you said, hiring the wrong people, hiring good people, finding out, it's just part of the process. So with regards to sticking to SOPs, it's not just team members, it's even dentists. Like, you know, like I said, I've got the whole consultation, they don't stick to it. Constant reminding. Why? Where are we going? Look, yeah, our conversion rates are dropping, right? We need to do more training. It's constant. And that's why having sort of, you know, people in the right positions, like, you know, adds in operational manager, he can keep an eye on that. I can keep an eye on the clinical team.
Yeah.
My wife's looking at compliance and finances and so forth. So you need all those departments constantly checking where we're falling short. But it's never going to be 100% smooth sailing.
No, yeah.
I guess as the business owner, it's just constant auditing, right? And just making sure that everybody's still hitting their KPIs constantly. Yeah.
I think that's one thing, like, I think when we first started off, we always thought, okay, one day everything's just going to be smooth. And we're still like, that's the thing. That's what I've realized is we have to be comfortable being
uncomfortable. Absolutely.
Because it's never, there's always, especially as you grow as well. I feel like if everything's running too smooth, you're not doing enough.
You're not doing enough.
Yeah, you're not doing enough. So
I just want to be comfortable. It's like, really? Yeah, like did that ever exist? Yeah. If it's not something in business, it's something in your personal life. It's not something in personal life, something with the kids. Like, you just have to be used to swimming in deep waters.
Yeah. No, yeah. 100%.
Yeah.
So in terms of patients coming in and when they kind of like have price objections, do you feel like a lot of the times it is a price objection, or do you feel like maybe it's something else that the clinicians maybe not done enough to show them the value?
Very good question. Very, very good question. Price is, you know, to be honest with you, is probably, see, the thing is with me, Joe, if price is the only objection, I'm a very happy man, because it means I've ticked off all the other boxes. I've explained to them, you know, they're happy with the patient journey. They're happy with what the clinician has said, you know. So in the consultation, actually, one of the questions I do ask patients is, you know, apart from, you know, we'll get onto the price element of it, but apart from that, is there anything that you want to ask me? Are you happy with everything? Yes, doc. You know, have I explained things? Okay. Yes. So now it's just a price issue. Now, if I know a patient's got a price issue, I can overcome that objection.
Yeah, somehow. I think that's a great point of what you said, is like in terms of the tie down, and say, okay, so other than the price, is there anything else? Like, once you get the tie down of the price, you go, okay, Now you know that it's...
Now I know its price
Yeah,
because the thing is, if I know it's just that, I can work on that and we can handle that. Now we've got the benefit, and this, you know, when we start the practices, you know, we've got something called a lot of price elasticity, because obviously we own the lab, and you've got the lab, and you know, we use certain implant systems and so forth, and that's why we picked certain implant systems over others, because you can omit, you know, like abutments and things like that. But that's another conversation for another day. But you know, we also have the training academy as well. So if the patient hasn't got the affordability, we can push them onto the training academy. So I hate a patient that just doesn't have treatment with us. Reason being is that I genuinely think that we can just provide the best treatment. And as an owner of a business, you need to think you're the best.
Yeah.
Then why else would you go into business,
Exactly.
right?
So where do you think most dentists are going wrong in that process of actually creating the value behind the treatment? Where do you think a lot of dentists go wrong with that?
I think they go wrong from the outset, mate. I think I really do. I think when they're, you know, you'll see it when we're opening up private squats. There's no clear vision. There's no, what are we doing differently? I think a lot of dentists just think, you know what, it's a good idea to just open up a business, but haven't really thought about it and really honed their skills. Remember, I opened this after 15 years of practice, a big thing like this, but I knew my craft. I knew how to deal with every single complication. I was very, very sure of myself as an implant surgeon, you know, because patients see that. They know if you're putting it on, because they can see right through you, and they can see if you've got the confidence or not. And it always helps having a few gray hairs, you know. You got yes. Yeah. There's no harm, and I talk about it in the book. There's no harm in waiting for the right time to start this journey, you know. And you know, Michael Gerber talks about it in the E-Myth as well. A lot of dentists have entrepreneurial seizure. They think, well, I'm working for somebody else now, I should do it myself. But all of a sudden, there's a whole different element they need to think. They need to think cash flow, finances, HR, and the list goes on. Oh my God, they're deer in headlights now. And you've seen it. We see it all the time. So there's no harm. There's no harm in waiting for the right time. You know. But I was speaking to a few years back a very big cosmetic dentist. His name is Michael Apper. We were over dinner, and he said, you know, Adeel, these people think that I've just come about and started doing all this marketing. He said they don't know how many years I've been in the trenches. I've been in the trenches for 15 years before I even started marketing. I said, you know, that's I took a big lesson from that. I said, you know what? That's what I respect. People respect people with integrity, credibility, and they own that space. And you can't fake that. Do you see what I mean? So I think a lot of dentists just go into things thinking, well, you know, I'll just follow the trend and do this thing, you know, because it's a big decision.
Yeah. I think that's a really good point that you mentioned. It's something that we try and do when we onboard a new client, is to actually get clear on where it is you're trying to go and who you are. Because if you don't know who you are and why a patient would come to you, or what makes you different, your USPs, then you're just going to be like everyone else in the market. Like, I think the thing that kind of sets you guys apart is obviously your skill level, like the type of implants that you do.
But Joe, just sorry to interject, but I know that I can do complex hair. The patient doesn't know that, right? They just think, well, he's a dentist, so they, you know, Joe Bloggs doesn't know me from anyone. I'm just a dentist, right? There's a new dental practice. When they come into the practice, how are we different? It's only there's a lot of process that goes into it before they actually come into that chair, right? So we have to win them earlier on in that journey, right? So how are we different from inception on that patient? Does that make sense? I know that I can do X, Y, and Z. The patients don't know that, and do they care? I don't know, but we have to win them, and then when they come in there, then you've got a chance to explain, well, this is how we're different.
Exactly.
Yeah.
So what have you kind of learned about marketing since you've been like in dentistry? I don't know if it's something that you thought that was important early on, or what, but what's your kind of thoughts towards like marketing?
Let's do both. So as your personal brand, as the dentist, and also as the practice as well.
Yeah, I think it. So you know, I've obviously do a lot of personal marketing now. For me, it's, I mean, we were talking about this before, getting sort of brand awareness, but doing it at a time where you can where you're credible enough to do it.
Yeah.
You know, because there's a lot of, you know, unfortunately we're seeing a lot of things on Instagram that are just not a real depiction of people's lives.
Yeah.
You know, and for me as a father and as a husband, the last thing I would want to do is put something out on social media and my children think, well, that's not really my dad. I mean, what kind of example am I setting for them? Do you see what I mean? So, doing it when it's the right time for you, because it can be a very dark place as well. You can get caught up in it very, very quickly. But you know, I always, you know, in-house referrals are always the best. You know, if you've got a practice, you know, those patients are sort of loyal to your practice, your brand. You know, but again, if you're opening up, our business is very, very different. It's very implant centric, implant heavy. We're doing very, very sort of complex work, and marketing is the lifeblood of the business. Absolutely essential. I think a lot of companies, I mean, we have cycled through quite a few companies, because I think what we found is a lot of companies, so they'll sell you the dream, they'll sell you the vision, but then when it comes to execution, it hasn't come about. Yeah. Now, there's a big responsibility on the dentists as well. You know, I think a lot of dentists, because they don't understand marketing, they're just expecting a patient to come in ready to purchase.
Yeah.
And if it doesn't happen, then it's the marketing team's fault. It can be further from the truth. What's the? Do you know what? I was having a discussion with a colleague today. I said, when have their leads ever been good? Like, do you know what I mean? You know, here you go, sir. I want to pay you X thousand. Yeah, the leads have never been good. You know, but how do you build value in what you're giving? Why should they pick you? You know, there's a want, there's need. They want to get done, but how do you get that person to transact in your dental?
I think that's a great point. I think a lot of dentists, because look, we speak to hundreds of dental practices on, like, every couple of months we're speaking to hundreds of practice owners. And I think a lot of people are going from marketing agency to marketing agency.
They're looking for a magic pill.
Yeah, and they want the patients to turn up at the door and say, here's 20 grand, do my teeth. But like,
when you find that company, just let me know. Yeah.
No, but yeah, so it's all about, as you said, creating that value when they come in. And I think a lot of people who are used to word of mouth and referrals, marketing is a completely different game.
Yeah, it's totally
you have to do a lot more work for people who have no idea who you are. They're probably skeptical already. You have to do more work with them. And I think that's something that people have to understand when they come into working with agencies is look, there is a responsibility on you as the dentist as well to give that patient a good experience and accept that they're not going to be the same as a referral who Jenny's told her mate that this is the best dentist ever. It's an easy sale. So,
and I think as well, having unison amongst the team, so that, for example, the first visit of a patient, they might have a 10/10 experience, but then the second time they come in, they might even be a couple notches down. Maybe the receptionist or the TCO is speaking to them in a completely different way. And then suddenly that patient's relationship with you is almost, and their mindset towards you kind of
This game is too sensitive.
Yeah.
Especially when you're a new business. Yeah, anybody that drops the ball could be detrimental to your business, right? And my philosophy is that, you know, I've got it in my head that, you know, all the leads are poor quality.
Yeah.
Any lead that comes through the middle. So that puts me in a psychological state that I have to work damn hard. My team has to work damn hard to create value for that patient. Because we know we're giving a good service. We know we're giving a good product, i.e. dental work inside the mouth. You know, we've got very, very high clinical standards. So why shouldn't they have it done with us? But we have to work hard to get it. And I like that. I like to lift, you know, and sometimes it's too hard for some team members. Maybe it's not the right practice for you. But one thing is, they see me doing it. They see the owners doing it. Everybody has to raise their game.
Yeah. I've got a question now. I want to dive into a little bit about the book and the Komodo approach. What is, like, obviously everyone go and get the book, but just give us an idea. What was the inspiration behind the book for you, and what made you actually want to? Not every dentist wants to write a book, right? So what?
No, do you know what? So I used to do these. You know, I used to, like I said, for 10 years, I was up and down the road to Southend-on-Sea to Norfolk. I used to do hours and hours of driving. You know, And when you're driving, sometimes you're driving on the road. Sometimes you're on the M25. You're thinking you're in M1. Yeah. I'm sure you've done that. Yeah, what motorway am I on? But then you end up home somehow. So I used to do a lot of daydreaming. I said, you know what? I've got so many, from the experiences I had working in different practices, dealing with different patients, dealing with different teams. Just all these ideas were collating in my head. So one day I just want to put this all down into a book. And then I think a couple of years ago, I started. I've been on and off from doing mixed martial arts and jiu-jitsu and stuff. So I started doing private tuition with my Brazilian jiu-jitsu coach, who's actually blind. And I tell you what, I've never felt a stronger guy in my life than him. His name is Zaid. And he just, like the thing with jiu-jitsu is you can be so aggressive and trying to move. And what he would do, he just calmly just pin me down. He's not moving at all. And he just slowly maneuver and just dominate with ease without expending energy. And it just reminded me of a Komodo dragon, how it moves step by step. But if it wants to put it on, they'll put it on fast. Yeah. So I said to Zaid, I said, how you do jiu-jitsu? It just reminds me of a Komodo dragon. I'm going to call you Komodo. And I said, you know what? The way you practice jiu-jitsu, this Komodo approach, you know what? Business should be done like that as well.
Yeah.
He's like, how do you mean? I say, what? You're just flipping calm. If you've got an opponent that's going mad, you're resilient. You keep a flat horizontal line. You don't get emotional into this thing.
Yeah.
You're just holding your position. But then when something comes on you, you clamp down on it. So that's where the whole Komodo approach. I thought, you know what? Let me incorporate this into the business world. So how I did it, I took my time in my implant journey, step by step, learning, step by step, calm, a whirlwind of issues coming up, with family, with work, litigation, whatever it may be. You just got to keep focused on where you're trying to get to, Then when the time is right, boom, we go into business.
Yeah.
So I was kind of building. Well, I wouldn't consider my first practice with my business as a real business. It was kind of a tester one, but my first real business started just after COVID. So that was probably like 12, 13, 14 years after qualification. But the time was right there. But because we had all these skills, I was ready to take a business and hockey stick it. So the first real practice I bought with my business partner, we doubled the profit in a year. And then we got the next one, we got the next one. So, because, so what I could have done is had very, very slow growth if I bought early.
Yeah.
But I did it the other way around. Gain the skills, learn. But then when we apply it into business, we go quick. And that's why a big part of SmileWell, why it's successful today, is because we did it at the right time. Yeah. You don't need to go into business because your mates are doing it.
Yeah.
For sure.
So you obviously scaled SmileWell and the practices here in the UK so much, and now obviously there's the Qatar practice as well.
Yeah.
So I just want to get a bit of insight into that transition going from, scaling practices here in the UK to Qatar.
Yeah.
If there was much of a shift in the framework of actually doing that, and also if there was a cultural shift within the patient dynamic.
Oh, huge. So just imagine you've opened up a squat, and then a year into the squat, you decide to move country. I mean, you just couldn't write it. I mean, what we're doing here, but we've always wanted to move abroad. My son is going to start GCSE, so we wanted him at least to do a year before he starts GCSEs. And realistically, if you do GCSEs, you're not going to move because then go to A level, and you can't do it. It's either we do it now, or we don't do it at all. So we went on a holiday to Qatar in August 2023. We loved it, and by August 24, we were moved. So exactly a year. So yeah, and within that, finding a practice it's just totally different. If you think compliance is tough here, you should try Qatar. It's a different beast. It is a totally different beast. If you want to open a practice here, you need to have certain team members. You need 2 specialists. You can't open up a practice.
Really?
You can't open up a practice without 2 specialists on a full-time wage, right? So, okay, I don't know anybody here. How do I find dentists? How do I do this? How do I recruit them? So again, it's that entrepreneurial spirit, right? I need to make contacts with people.
Yeah.
Like any give me a lead. Can you introduce me to someone? Just constantly, some meetings would amount to nothing. Some would be a good lead. Some people over talk a proposition, but then fall through. Like, it's constant. Like, who put me in front of people that I can talk to? Yeah. Same with my wife, just talking, and building relationships and networks. Yeah. And now we've got a clinic that's just been open probably about a couple of months now. And everybody said, well, you're not going to do well, even to hit break even, because it's a small population, and even the dentists, like, well, they've never seen this sort of growth in a startup in Qatar. They said, you're doing things very, very different, So it just there's no secret. It's just hard work, and just got to knuckle down and resilience more than anything else.
Well, yeah. So congratulations on that, by the way. Must have been a journey to get through that. But like, one of the final questions I've got for you is, what kind of like legacy do you want to leave as a dentist to your dentist, and just like in general to your kids? If you were to look back at the end of your life, what is it that you really want to achieve now?
I was thinking about this question when I was having a shower yesterday morning. And no, actually, was it this morning, yesterday morning? I was actually thinking about that, and I said, if nobody remembers me, I don't really mind. That's the truth.
Yeah.
Because the ultimate thing is, what's God's opinion of me? That's the first thing. Because remember, like, most people are just forgotten.
Yeah.
But if I am remembered for something, I want to be remembered how I built people up.
Yeah.
And how I made them feel, and how I contributed for them to take care of their families. That's it.
Very nice.
That's it. That's it. And he was a good man. You know what? He didn't do much. He was a dentist. He fixed some teeth, but you know what? He helped this person bring their life back. Like, through confidence, or he helped in these people in charity. He made people feel good, and he was a giver, and he gave from the heart. That's it. That's it.
That's wonderful, by the way. And so, in terms of what I want to touch on before we close this off is the Implant Growth Academy, because I've seen some of the stuff you guys do there, and I think it's a transformational course for these dentists. So can you tell us a little bit about what is the Implant Growth Academy and who it's right for?
Yeah, so look, I mean, the UK doesn't really need another implant course, to be honest with you. But what we found is that a lot of courses out there, and a lot of feedback that I'm getting, and there's some great courses, but there'll be people that are doing implant courses that aren't sort of executing on implants, because they're not sort of being mentored and channeled in the right direction. So what we wanted, I wanted to be different. I wanted to always work with a small cohort of people, because remember, the courses aren't the business. If that, I'm doing it for passion and wanting to teach. I've always wanted to teach small cohorts of implant dentists, and take that group on a journey together, so they're accountable to one another. Because accountability is what's going to make you succeed, right? So so we've got a 4-tiered course. So it goes from basic implantology, learning basic implantology, over 1, 2, 3, and 4 to become a complex, doing complex surgeries like zygomatic implants. And I think I can take a newbie to complex implant surgery in probably about 5 to 7 years. It's tough, but it can be done. But what we wanted to do is take the guys from tier 1. They all move together through the tiers. And then so what we've got our first tier 1 group. There's 6 of them. I only wanted to do 4.
Okay.
But we've got 6 of them, and they've got a very good family approach. They're helping one another, and this is exactly what we wanted to create.
Community, sort of.
They've got a community, and they can only go as quick as the slowest guy in the group.
Yeah.
So they're all accountable to each other. We're not going to move them onto tier 2 until all of them are competent, are ready for it. So they're on a journey together. And that builds up a lot of camaraderie. So this is how we're very, very different, and we obviously do a lot of the mentorship, and the feedback that we're getting, I know it's my course, but the feedback's been great. And again, they just like the fact that the people, myself, Victor, Dr. Victor Gihani, Dr. Ricky Bopar, Dr. Anmol, like Dr. Anop Ladvad, the guys that are running the course, we're very interested in them as individuals, as a person. That they'll, I'll get a lot of mentees showing me x-rays and saying, look, doc, look, this is the job I've done. I was like, yeah, that looks good, but how's your relationship with your wife? Yeah, I'm more interested in that. Oh, have you seen the kids today? Like, mentorship goes like, it has to go deep. It goes deep, man. It has to. It's not surface level, man. I want to make. I want you to be a good clinician, yes, but how are you? How are you are you a rounded individual?
Because that's ultimately going to come into your clinical work, right?
That's going to come into your clinical work.
Patient,
Yeah,
patient relationships and everything.
exactly. And it comes back to your question: how do you want? I want to be sort of remembered as, like, this guy helped me, not just in one domain, but to become a more rounded individual. And I wish I had a guy like me. I did have it in Balu, but I wish there was more people like me to give at that time. Do you see what I mean?
So for the course, so I know you said it's like you've got the tier system, right? So you've got your tier for the beginners, newbies. Like, for those that are literally just fresh out of university, how early can somebody be in their journey of dentistry to actually go on to that
Well,
course?
I was very strict about it before. Yeah. I was like, you can't, because that's what my mentor said to me. He said, Adeel, you can't do an implant course before you do 5 years of NHS dentistry. So you need to do the volume of work, and you need to get good with your hands, so the hands are moving. 5 years, and then you consider. So I did that. I did 4 or 5 years before I did an implant course, and I was stuck on that. But then, obviously, with the passage of time, there's more education, there's more, online. So it's a great time to be a dentist with so much accessible information. So one of my guys, his name's Imran, it's just blooming. He's been qualified for 2 years. He phones me up. He says, I've already done an implant course. I want to come onto your tier 3 course, full arch. I said, hell no. Nah, mate. This goes against everything. I said, look, you can only do a full arch with, minimum 100 implants.
Yeah.
Minimum, to show me that your hands are, can do something, right? And he's like, well, I'll do this, I'll do. And he twisted my arm, right? And I tell you what, he's come on the course, and he's he's probably one of our best delegates at surgery. And his knowledge, I don't know what it is. Maybe maybe because he's young, he just absorbs everything.
Yeah.
And he's bringing cases. We talk about cases, and his hands are good, and he's very, and that's just totally changed my way. So in answer to your question, I think dentists can get into implantology a lot quicker, but they do need the foundations, of restorative. They need to understand prosthetics, restorative, and occlusion before they embark on a implantology course. But certainly, yeah, the threshold doesn't have to be 5 years. You can 1 or 2 years, something like that.
Sure.
Yeah,
makes sense for sure. Okay, so one question that popped in my head as well that I forgot about from earlier. So practices nowadays, can you scale your practice to super heights when it's just a one surgery place? Is that, or in this day and age in 2025, do you think that the best route to scaling a practice needs to be multi-surgery?
it
depends what you want.
It depends.
Yeah.
It depends what you want. I know what I want. I just want to push it to the limit.
Yeah.
That's who I am. But that's not necessarily somebody else's dream. I've got very, very, good friends. I've got a single surgery practice. They got a good work-life balance and they're enjoying life. This dream is not for everybody.
Yeah.
So you have, again, it comes down to the individual. Who am I? What am I about? You really need to spend time on that.
Yeah, I think self-analysis is super important, because I don't even think practice ownership or entrepreneurship is worth it for the majority of people. I think it's so glorified of like it was that's really how we got into it, because you see the Instagram, you see the 20-year-old making 10 million and you think, oh wow, that looks great. And then you get into it and you realize it's just beating up all the time, getting battered day after day. And
it takes a strong individual to say, you know what? I'm not going to live somebody else's dream. I need to know who I am, what I'm about, what my values are. And remember, that changes with the passage of time as well. So today, I'm very different to when I'm 40 now, but when I was 30, I had very different aims and objectives, and it changes as well. So you have to be cognizant of that as well.
What would be your advice to us as 25-year-olds? I'd just like to hear your advice to us being 25.
I mean, 25, you're still kids, man. You get it. You still. I think, well, not only, and I've told this to both of you. For what you've done in a very judgmental industry. We're not easy clients to please, dentists, where we do our due diligence and stuff. What you've done and the traction that you've got in such a short period of time at your age is phenomenal. Yeah, so you just need to realize that. Again, I'd speak to you as if you were my mentees. Make sure that you're doing the business side, but you're also working on the other aspects of your life as well. Don't delay the things that you need to do. Like for me, family is a big thing.
Yeah.
Don't neglect that. Bring, if you've got a spouse or a partner, wherever it is, make sure you bring them on the journey as well, because at some point they're gonna be your backbone. If they're not your backbone today, then they'll need to be your backbone. A lot of dentists go wrong with that. They're growing, but they leave their spouse in the background, and then that's when problems. So
Create like a double life.
double life. I get all the excitement at work, go home, and it's just doom and gloom, right? You need to bring your not just your spouse. You need to bring your children with you. So my children and my wife are all on that journey. This is like, kind of thing like David and Victoria Beckham. The whole family was on that journey together, like the Cardones. So we kind of we call it the Allies, right? So the three kids, mum and dad, were all in this together. So bring. If you're thinking about starting a family, make sure you bring your family on that journey as well. But in your 20s, I always say to my guys, you got plenty of time to make mistakes. I think the most challenging decade. I mean, I've only lived from I'm 40 now, so that last 10 years has been relentless for me. It's been tough. Yeah, really tough. Because look, most people probably get married in their 30s. They have all their children probably in their 30s. They probably buy their first house in their 30s. They start their business in their 30s, and you have to manage all of that stuff, right? And certainly in my in my experience, the cash flow demands were just astronomical. Yeah, and I'm just so happy I'm through that.
Yeah.
So just prepare for that as well, And you guys have got a very, very good partnership. Value that. Grow each other. Yeah, remain loyal. Don't let finances compromise your values. Yeah, never let your finances. I've seen that happen to a lot of people. Never let finances compromise your values. And if you think that it would, be honest about it and work on it.
Yeah.
Do you see what I mean? If you're a little bit too much, if like at a point in my life, I was like, maybe finances. I'd give up a lot of things for finances now. I'd sacrifice finances for spending time with my family. Now I wouldn't, because I've worked on myself. I've changed do you see what I mean? So be open and honest with yourself. Be open and honest with each other. Talk to each other a lot, and support. If you want a lot of support, Joe, help him. Then he's gonna help you. Do you know what I mean? To give a lot, you're gonna get that in return. Yeah, and build each other up.
Thank you, man. That was really good
Yeah,
for sure.
So, where can people find you, Adeel, if they want to contact?
I'm here. I'm about, man. I'm about. Look, you you find me on Instagram, Dr Adeel Ali.
Yeah.
I'm a very approachable person. Look, I am normal guy. I am a normal guy. I've just been blessed, with good things by the grace of God, and I'm very cognizant that one day God gives and the other day he takes, and I've been through both. And I think we just need a few more just real stories, real people in dentistry to say, what, if you make a mistake, if you're getting challenges, it's normal. Yeah, so you can find me if you want to come to Smile, see how we did it. We're more than happy to sit down, talk about our journey over some coffee. And these things don't cost. Building relationships doesn't cost. I've never been transactional.
Yeah,
like that. I'm always just good vibes, and hopefully people appreciate that.
Yeah.
So
And it was interesting on the way down. Actually, I know that you're very into jiu-jitsu, right?
yeah.
Myron actually did karate as a kid, so he said he wants a spar.
Well, man,
Not my weight class, really.
no, well, listen, man, you're 25, man. I wouldn't want to mess with that, man.
That deal, bro. Thank you
so much.
Been such
Big pleasure. Thank you so much. Thank you. I appreciate
So, thank you guys for watching this episode. It's honestly been such a pleasure, and I'm sure we'll do another one.
I'd love to.
Again soon. And all of the links for Adeel will be in the description. If you're interested in the academy, there'll be a link to the book in there as well. But yeah, we'll see you on the next episode.
Big love, man. Thank you so much.
Cheers, bro.
Lovely.
We've got one commodity, 2 lizards.
That's a good one. Yeah, you should do that. Come on, 2 little. No, one iguana and one.